So, it's come to my attention that there are a number of people who feel uncomfortable with the preparation and administration of ketamine for pain relief. So I just want to really quickly go over the appropriate preparation and administration of ketamine. So first off, ketamine. This is not ketamine, but it comes in a vial that looks roughly like this. Comes, generally speaking, 500 milligrams in 5 milliliters, breaking down to 100 milligrams per milliliter, which is a lot of ketamine in a very small package, which is why we're going to dilute it. So first, we are going to get a 10 milliliter syringe. We're going to attach that to our 3-way stopcock. So when we're using the stopcock at this point, we want to make sure the off is pointed towards this port here. Next, we are going to add our needle. Up top, just like this. So at this point, it looks essentially like the stopcock is just an extension. Next, going to take our vial, pop it off. We are going to drop 1 milliliter, which is 100 milligrams of ketamine. So, and you can draw up really however much you like. Make sure you get all the air out, and then push back until you have 1 milliliter. Knock it off. Now, I can get rid of this. Next, we have to dilute it. Right now we have 100 milligrams in a single milliliter. So we're going to take 10 milliliter flush. We are going to remove 1 milliliter, so it is 9 milliliters of normal saline. Perfect. So we're going to pop the side off here, just like that. We're going to turn the flange, so this is now closed, and we're going to add 9 milliliters of normal saline into our 1 milliliter of ketamine solution. There we are, and we'll close this off now. So, according to our pediatric med administration instructors, just drawing the medication in creates enough turbulence to mix it appropriately. I prefer to just sort of spin it around a little more, just like you would do with a blood tube. Nothing too crazy, just a few seconds, and that should be good. Now, we have 100 milligrams in 10 milliliters, or 10 milligrams per milliliter. So, from this point, we can administer with this concentration. First, we need to figure out our dose. So, the dosage for ketamine, in this case, is going to be 0.2 milligrams per milliliter, with a maximum of 25 milligrams per single dose. So, get the calculator. Always use a calculator. It will save much headache and heartache. Say we have a patient who's 80 kilograms. We're going to go 80 times 0.2. What do you know? 16 milligrams. So, we want 16 milligrams. We're going to take a 3 ml syringe. Now, each one of these little hash marks is a single milligram of ketamine. So if you're at the 0.5, that's 5 milligrams, 1 is 10, 1.5 is 15, and our desired dose is 16, that single hash mark past 1.5. So we're going to attach here. We're going to turn the flange off this direction to allow for fluid to flow up and in, and then we are going to withdraw. Now I like to pull in more than needed, so I'll go up to 2 milliliters or 20 milligrams to make sure I get all the air out, and then push back until I get where I want, which is right there. Lock that off again, And now we have 16 milligrams of ketamine. Now, when it comes to administration, you want to go slow. Recommendation is 2 to 3 minutes IV push. I prefer to start IV fluid and slow push it into the infusion line to further dilute it. The more concentrated dose they get over a shorter period of time, the more likely they are to develop sort of untoward reactions, and the more likely you are to have problems. So do yourself and your patient a favor and make sure you give it to them slowly. If you have any other questions, feel free to comment or contact me. Yeah.